Ya Alimadad. My name is Dr. Aladina. I'm an ophthalmologist, and today we will discuss the importance of eye health at different stages of life and review medical conditions that may occur throughout your lifetime. Starting from birth, babies born early, underweight, required oxygen, or a long stay in the NICU are at high risk of the eyes not developing properly and may be followed by an eye doctor closely after birth. The first few years of life are very important for eye development, and all caregivers can play an important role in monitoring for eye development. Look for misalignment of the eyes, if the child has a lot of tearing or crusting on the eyelids, whether they're overly sensitive to light or constantly eye rubbing, or if they're unable to follow objects when placed right in front of them. It is also important at this stage of life to receive all recommended vaccines on schedule to receive the full benefit of protection from these diseases. Some of these diseases can lead to eye health and even blindness. One thing to note is that the brain requires sharp vision to develop properly. Here is an example of normal sharp vision. Here's an example of someone unable to focus on objects far away. And here's an example of someone unable to focus on objects at close. Making sure the child has sharp vision is important for brain development. Poor school performance, poor social skills, and even behavioral issues can be caused by poor vision, and your eye doctor may recommend glasses to help correct this issue. Remember to obtain a vision screening between the ages of 3 or 4 or before the child enters school. If the child fails a vision screening, they will need a comprehensive eye exam by an eye doctor. These early years of life are a great time to instill healthy habits with good nutrition. Try the color your plate method at mealtimes. Think of vitamins A, C, and E, ACE, when thinking about eye health. And there are other micronutrients that also contribute to eye health as listed here. Limit screen time with young children. Children between the ages of 2 to 5 should never be watching more than 60 minutes max. Instead, encourage outdoor time. Outdoor sunlight is good for eye development, and studies have shown it to reduce the risk of myopia or nearsightedness in children. And also, please make sure household chemicals are safely stored away, as chemical injuries are the number one cause of preventable injuries in children of this age. Then, as we transition to teenage and young adulthood, remember the eyes are continuing to grow and mature, and it's a good idea to continue those same healthy habits we had in childhood. Think of your glasses as a tool, like the shoes on your feet. You want to make sure you wear the correct size, especially if your eyes are continuing to change. Otherwise, you may experience eye strain, headaches, migraines, and even difficulty at night, especially with driving. Avoid smoking. There is no form of safe smoking. Cigarettes, vaping, water pipes, or hookah. Smoking is not safe. Another thing is that eye injuries are very common at this age group, so to wear protective goggles, especially when engaging in team sports or high-risk activities such as handling chemicals. Next, as we transition into middle adulthood, these are called our productive working years. Certain medical conditions, like the ones listed here, can affect your eyes and may require a comprehensive eye exam by an eye doctor. Remember to continue to avoid smoking, as it has detrimental effects from head to toe. One medical condition of note, diabetes, affects the small blood vessels in the body. If your blood sugar is not under good control, it is possible for complications to occur in your eye. This can lead to vision changes in the center of your vision, or even have floaters as depicted here in these two examples. You need an annual eye exam by an eye doctor if you have diabetes. Another common eye condition called dry eye syndrome occurs during middle adulthood. People tend to make fewer tears as they get older due to hormonal changes. This affects women more than men and those with other underlying medical conditions, or even certain medications that you take by mouth can affect the quality of the tears that you make in your eyes. Next, as we transition into late adulthood, we call this the quality of life years. Due to longer life expectancy, healthy eyes and vision are required for our daily living. We continue to drive, read, watch TV, engage in hobbies, and even independent living, and healthy vision is essential. Healthy vision is also required for an aging brain as it plays a role in memory, mood, and even our sleep pattern. There are three eye diseases that can cause vision issues in this age group. The first one is cataracts. This is a natural aging process of the clear lens inside our eye that becomes cloudy. This can lead to vision appearing blurry, hazy, and less colorful. It can also cause glare, especially with nighttime driving. The next is age-related macular degeneration. This is a condition that causes visual changes to occur in the center of one's vision. Risk factors include old age, family history, smoking, and a poor diet. And the last one is something called glaucoma. It's a disease that affects the optic nerve and its fibers that are important for maintaining vision. As glaucoma worsens, it can cause blank spots in your central and peripheral vision. These changes may not be noticed until there is significant damage, but as the damage continues, the blank spaces may become enlarged. If enough damage occurs, it causes blindness. This is irreversible. Therefore, it is important to get eye exams, comprehensive eye exams, in this age group to rule out any of these eye diseases that we mentioned. And last, we'll talk about the different eye health professionals and what role they play. Know your O's. An optician are technicians who design, measure, fit, and adjust eyeglasses and contact lenses, and they work in various settings, including optometry offices and retail vision stores. An optometrist, or a doctor of optometry, is an eye doctor, a primary eye care provider, and they conduct eye exams, diagnose and treat vision problems, prescribe eyeglasses and contact lenses. They can diagnose and treat many common eye conditions. And last, ophthalmologists. These are medical doctors who have specialized training in the medical and surgical care of the eyes. They are qualified to perform eye surgery. They treat a wide range of eye diseases and prescribe corrective lenses if necessary. In summary, eye health is important at all stages of life. There are many medical conditions and lifestyle choices that can impact the eye and lead to irreversible vision damage. Working together with your healthcare team can preserve healthy vision. Thank you, and please visit the Aga Khan Health Board website for health information, mental health resources, and access to hundreds of healthy recipes. Website as listed below.